Hello there! Hello nurses and hello world! This is Nurse Niezl and welcome back to my channel! Video is solely for demonstration purposes only, as interpreted by the actor based on her understanding of the specific skill with reference to the Royal Marsden 10th edition. All information presented are public domain materials accessible to the relevant governing organization's website. Subtle similitude may be noticeable. However, this is not intended to be definitive guide to the NMC Part 2 test of competence or the Osce examination. This can be helpful materials for overseas nurses or internationally educated nurses to learn and adapt to the UK clinical setting and transition effectively into practice. First of all, I'd like to thank everybody for your support. We are now on our 10K subscribers. Thank you very much. Hence the haircut. Just kidding. But anyway, it's summer, so I need to get my hair. Anyway, thank you everybody for subscribing and for liking my channel, and we are off the chart. Let's go. So I am amped and energized today to make more videos for you guys. As requested, I'm going to do another evidence-based practice, and we're gonna finish them all of the evidence practice, okay? And then we can proceed to the professional values. I have already discussed regarding evidence-based practice and professional values. Whatever you're gonna have in the exam, you're gonna have a constant APA or assessment, planning, implementation, and evaluation, plus evidence-based practice and professional values. So, and then 2 pairs of 2 skills. All in all, when you have your exam, when you have your Osce exam, you'll have 10 of them. 10 stations, okay? Anyway, going back to our topic for today, it's about evidence-based practice. And again, you'll have 10 minutes to complete this station. It is a writing station or a silent station in which you're just gonna have to write in silence. So, let's see, among all this topic right here, which one are we gonna do today? How about dementia and music? So before we start, I would like to ask you to please give this video a like and subscribe to my channel. Also, if you want to get notified just in case I post more Osce videos, then hit the notification bell. Oh yeah, also if you want your question to be pop up to the top and I'll be able to see and reply your question as soon as I can, then please click the join button, okay? And also, as part of your perks, you're gonna be the first one to see the videos that I posted. That's part of your membership perks, okay? Also, like I said, if you got any question for me, I'll be able to answer it, okay, firsthand. Alright, everybody ready? Yeah? Okay, let's first define this term first. What is dementia? What is dementia? Dementia is a syndrome or a group of related symptoms associated with an ongoing decline of brain functioning. There are actually many different causes of dementia and many different types. Dementia symptoms may include problems with memory loss, thinking speed, mental sharpness and quickness, language such as using words incorrectly or trouble speaking, understanding, judgment, mood, movement, and difficulties doing daily activities. Did you know that the research shows that there are more than 944,000 people in the UK who have dementia, meaning 1 in 11 people over the age of 65 have dementia here in the UK. The number of people with dementia is increasing because people are living longer. It is estimated that by 2030, the number of people with dementia here in the UK will be more than 1 million. Alright, now that we know what dementia is, let's start with the music. Now, let's define music. Music is the arrangement of sound to create some combination of form, harmony, melody, rhythm, or otherwise expressive content. Listening to music is a common means of entertainment. Now, let us define music therapy. Music therapy, an allied health profession. This is a clinical and evidence-based use of music intervention to accomplish individualized goals within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. Music therapy is a broad field. Music therapists use music-based experiences to address client needs in one or more domains of human functioning: cognitive, academic, emotional or psychological, behavioral, communication, social, physiological, includes sensory motor, pain, neurological, and other physical system, spiritual, and aesthetics. Music therapy aims to provide physical and mental benefit, and then music therapists use their techniques to help their patients in many areas ranging from stress relief before and after surgeries to neuropathologies such as Alzheimer's disease. Studies on patients diagnosed with mental health disorders such as anxiety, depression, and schizophrenia have associated some improvements in mental health after music therapy. The National Institute for Health and Care Excellence, or the NICE, have claimed that music therapy is an effective method in helping individuals experiencing mental health issues, and more should be done to offer those in need of this type of help. Music. Yes, music. I love music. Anyway, so there's a lot of research out there, and candidates, I need you to read some of those research out there so you'll know why we have this marking criteria when it comes to dementia and music here in the Osce exam. So here are some of the research that I got from the web. It's all about dementia. It's all about having music therapy being helpful when it comes to dementia patients. Does music really helps improve the symptoms of dementia? We don't know, but we're gonna know, and I need you to also do some research for yourself, okay, if really that is the case, okay? So let's start. So let's go back to the main reason why you're here watching my videos. Isn't it to know what to write on your evidence-based practice, isn't it, regarding music and dementia? So again, like what I've said a while ago, you're gonna have a definite evidence-based practice and a professional values, whether you like it or not when you take your Osce exam. But with this number of evidence-based practice and with this number of professional values, there's just too much to memorize, isn't it? So I am here to break it down to you, okay? And I'm gonna teach you how to highlight those keywords that you need to remember in order for you to pass the Osce exam. We need to base it from the marking criteria because marking criteria is the Bible for passing your Osce exam. So let's start. Okay, candidates, I'm gonna need you to take a look at this marking criteria. This is the marking criteria from the NMC regarding dementia and music. Take a look. So the question still lies in there. How are you going to memorize all this after reading a research? Because you're going to be given a research as well. You're going to be given 10 minutes to finish this station. You're going to be given a research-based research regarding dementia and music. And you're going to break it down and making sure that you follow this marking criteria. this marking criteria that I've just shown you. Okay, if you're still in trouble finding the marking criteria, you can go to the nmc.org.uk for you to be able to know what are those marking criteria from the Osce exam. It's readily available in their website, okay? Anyway, I'm gonna teach you how to break this down for you to get those keywords, for you to highlight them keywords in order to take with you in your writing exam. So with this marking criteria, how are we gonna break it down? Okay, so let's highlight the word music therapy. Benefits for those individuals who have dementia. So remember those words and then just, play around it, get some other adjectives or get some other words from the research that you are reading, because you really have to read the research. But anyway, you have to follow the marking criteria. So I'm helping you now to remember the marking criteria. So when you get to the exam, you already prepared for the battle because you already have the weapon during the war. Erase, I don't like that word. But anyway, you already have the weapon for the battle. Okay, so I'm just using it figuratively. Anyway, how about this one? How are we going to break this one and highlight the keywords? Yeah, can you see it now, nurses? Okay, how about we highlight these words? Yes, as simple as that. Lack of evidence. That's it. So when you remember lack of evidence, then just add some words. Say lack of evidence that, music therapy really can improve the symptoms of dementia. But anyway, it's up to you how are you gonna make those words, as long as you remember this lack of evidence. And then, okay, I know what to write next. Yeah, that's highlighting the words. How about the third one?
Music therapy can positively improve depression.
Next one would be, yes, this is gonna be long, okay? This is gonna be long, like music therapy may have overall effect on overall quality of life of people with dementia. So it's a bit long, or you can just remove the music therapy, but this word should be there. That music therapy may have positive effect on overall quality of life of people with dementia. Okay, as long as you remember that word, you know what to say. Because you're gonna contraindicate yourself by saying, however, that. Okay? So how about this one? Yeah, that one. Okay. So, how about we highlight these words? How long the effects created by music therapy remain after the activity stops. Okay, so just highlight those words. The good thing about dementia and music, there's only 5 or 6 bullet points in the marking criteria, so you can just make sure that you structure these words, okay? Alright, these sentences. I'm just teaching you to highlight these words so that you will be able to remember this when you get to your exam. Okay? So that's it. Those are the things that you need to highlight when it comes to dementia and music. Okay, so now that you know the marking criteria and you know now how to highlight and remember these words, I'm gonna give you 10 minutes for you to write your answer, okay? So basically the scenario goes like, you got a patient named Bindu and Bindu got dementia, okay? So Bindu's daughter is asking you whether the music therapy is beneficial to improve the symptoms of dementia. So as Bindu's nurse, you need to make sure you know what to say to your patient's daughter. That's why here in the evidence-based practice, you will write as if you are talking to the concerned person. And at this scenario, it's Bindu's daughter or it's your patient's daughter. So how are you gonna write this? So basically, you have to summarize the findings first, summarize the findings of the article summary, and you have to draw a conclusion. And then later on, you have to make recommendations, okay? At this point, this is the time that the marking criteria is the answer for your exam. This is the time that you're gonna get the highlighted words from the marking criteria that we've just learned a while ago for you to be able to answer this summaries, okay? So for you to be able to answer this writing station. Now, I need you to pause this video. I'm gonna give you 10 minutes to write your answer and then go back, okay? Yeah? Ready? Time starts now. Oh, yeah. Hi. You're back so soon. Anyway, I know you've been waiting for my answer. Again, just a disclaimer. This is just my answer. I'm not saying that they are correct. I'm not saying that I will pass the exam when I take them. I've done my research. You are entitled to do yours, okay? So, ready? Oops, hang on. Before I show you the answer, please give this video a like and subscribe to my channel. Also, if you want to get notified just in case I post more Osce videos, then hit the notification bell. I really appreciate it when you are liking and subscribing to my YouTube channel because I'm more motivated to create more videos. Anyway, write your comment down below what other Osce videos you want me to do next. Here are my answers. Enjoy!
I will inform B's daughter that research trials have been conducted where music therapy has been introduced and that they have had some benefits for individuals who have dementia. Also, the patients involved in the study had all had at least 5 music therapy sessions. I will inform B's daughter that there is a lack of evidence that music therapy can improve symptoms of agitation. I will tell B's daughter that current research available suggests some evidence to show that music therapy can positively improve depression and this may provide a rationale for implementing music therapy. I will let B's daughter know that music therapy may have a positive effect on the overall quality of life of individuals who have dementia. However, this evidence is less reliable than the evidence on depression. I will explain to B's daughter that there is no clear evidence on how long the effects created by music therapy remain after the activity stops.
Thank you for watching and I hope you learned something for today. This has been Nurse Niezl. See you on the next one. Bye!
Congratulations to our new Osce passers. The first one we've got here is at Prosper Sayong. Congratulations for passing your Osce exam. The next shout out goes to at Ann Linda 7311. Congratulations to you as well. And here we go for another one. Cindy C. Lover, congratulations for passing your exam. I would like to welcome Fadikemi Arugbokun in our team and also Joy Dina or Dinah. Welcome to the team.